Welcome again back, viewers, to Exploring Lifestyles and Legacies. And today I am with Dr. Solomon Nzwanai Tapfumaneyi at Lowveld Intercare Consulting Rooms. And today we are going to discuss hypertension or high blood pressure. So, Doc, can you greet our viewers and proceed to give us a definition of high blood pressure and why it's so important for us to do public health education on high blood pressure, especially in the context of the way we live and our African communities and even the Caucasian communities. Yes.
Thank you so much, Doc. And hello, hi, how are you, our viewers? Thank you so much for having me on the channel. High blood pressure. So when we talk about high blood pressure, we're looking at the pressure that is inside our blood vessels. Right. So really we are talking about the blood vessels, the vessels that do carry blood from the heart to the rest of the body and from the rest of the body back to the heart.
Okay.
So they all have pressure that is sort of normal. But then when we talk of hypertension or high blood pressure, we're saying that there is the normal pressure that is supposed to be there.
What is this normal pressure, Doc? Our viewers would want to know what is normal and what is not normal. Perhaps you can let us know
more
about the normal values.
Exactly. So I'll start with the normal blood pressure. Say you go to your GP, say you go to any clinic, and then you have your blood pressure taken. So under normal circumstances, we usually say the normal blood pressure should be around 120/80. So there are like two readings that you see on a blood pressure machine.
Okay.
The one on top and then the one below.
Okay.
So the one on top, that's called the systolic blood pressure, and then the one below is called the diastolic blood pressure. So when it's normal, it's supposed to be around 120 to 180. And then when you look at a high blood pressure, looking at blood pressure that is beyond 130 on top, and then beyond 80, that is diastolic. So anything that is above that, we consider that as high blood pressure, and it has to be treated. So when it gets to be that high, it does have a lot of complications. It does have a lot of issues that we are going to discuss, and hence the need to be controlled.
Okay.
Sure.
Okay. Thank you.
Yeah. Sure.
Yeah.
Yeah. And then
so when you have defined for us what is normal and what is high.
Right.
Doc, is there anything like a blood pressure that is too low?
Right. Indeed. So thank you so much for that question, because I think it's very important to give our audience the rightful information so that they can actually know
when to come, because these days people have got these gadgets.
Yeah, right.
The one you have, they are measuring our blood pressures, our heart rate.
Right.
So one would want to know, you have defined the high one above 130, above 80 with the bottom figure. So what is too low? Because when it's too high, we are saying go to your general practitioner, go to your primary health care provider, go to your doctor. And when it is too low, I suppose somebody would need also to go to their doctor. So what is the definition when we are saying now it's too low?
Right. So when we look at a very low blood pressure, so the medical term is hypotension, which is as opposed to hyper. Hyper, that's something that's a high, a hyper. And then when it's low, we look at hypo, that is below. So we're looking at the top reading should be 90. So anything that is below 90 on top, and then anything that is below 60, that is underneath. So anything that is less than 90 on top and less than 60 below, we consider that as hypotension, and you definitely need again to go and visit your GP.
Okay, thank you very much.
Sure.
Then earlier on, you were talking about high blood pressure. When it is high, do we have any symptoms that we'll feel? What will happen to us?
Right. Thank you so much for that question. I mean, initially you mentioned that we need to discuss this in the context of our, our setting, looking at Africa, looking at Zimbabwe, and narrowing it down all the way to Lowveld and Chiredzi. So with high blood pressure or hypertension, it's very unfortunate that, we don't have symptoms for high blood pressure, or initially it doesn't have any symptoms.
Okay.
By the time you develop symptoms from high blood pressure, at that time it probably would have damaged a lot of vital organs, like the brain, like the heart, and your kidneys. Again,
okay, so let's rehash this again.
Right.
So we are saying you can be unwell with high blood pressure and you won't feel anything.
Right.
Right?
Right.
It's
That's
like
correct.
everything is normal.
That's correct.
And the only way to find out is regular checks.
Exactly.
Okay, thank you.
Exactly.
Yeah.
So with high blood pressure, there is always this misconception that, I can sense that my high blood pressure is high, when I have got a headache,
right.
Or when
Some people will say, if you upset me, my blood pressure will rise.
Will go high.
Doc, is that correct? That's it only becomes a problem when somebody is upset?
No, that is not true. That is actually a very, that is a misconception, I would say.
And also, therefore, on that point, can you tell us who gets high blood pressure? What causes it?
Right. That's a very important question because, most people tend to think that when you're like more than 70, when you're like 50, that's when you can only get high blood pressure. But, with high blood pressure, anyone can get high blood pressure. That's number one thing. And we're looking at as young as probably below 20 years, you can actually get high blood pressure even below 20 years and all the way up. So among some of the things that can actually cause high blood pressure, there is one cause that we actually do not know the actual cause, and then we call that type of hypertension primary or essential hypertension, whereby we necessarily do not know the cause. The cause are unknown, right? Okay. And then we also have something that we call secondary hypertension, like you have high blood pressure because maybe you've got an underlying ailment, maybe you've got maybe problems maybe with your kidneys
or your thyroid,
or maybe problems maybe with diabetes. Diabetes mellitus, you could maybe have high blood pressure from that.
Doc, is it possible that high blood pressure also runs in families?
Right, indeed. Yeah, we look at, genetics. So if your father and your mother, probably your sister, if they have ever had high blood pressure, you also have got a higher risk of also again getting, hypertension.
So, Doc, as you were explaining the causes of hypertension, I remember that in our community, some people might think that hypertension can also be caused by witchcraft, that their relatives or other people who might have bewitched them. Is that correct according to what we know as orthodox medical practitioners?
No, not according to orthodox medicine.
Okay.
That is not part of the causes.
Okay.
Yeah.
And then you were mentioning about, kept on saying complications.
Right.
What could these complications be? And also, before you answer that question, we as doctors tell people that high blood pressure is a silent killer.
Right.
And I think you have explained why, because you said usually there are no symptoms until when you get complications, isn't it?
Yeah.
So perhaps you can go on to tell us about the possible complications for untreated high blood pressure or somebody who takes their medication and then stops without the advice of medical doctors, without checking if it is safe for them to stop. Right. What could these complications be?
All right. Thank you so much for that question. I think the public has to know the complications of hypertension when it's not treated, or when the medication is not, when you don't comply to the medication. So we often describe to our patients that, it's a head to toe, in terms of pattern of complications.
Okay.
So when you look at from the head, we look at the brain.
Yeah.
So there is a risk of you getting a stroke.
Okay.
We look at the level of the eyes. You can actually get issues with vision. So high blood pressure does damage to your eyes.
Okay.
And then we go to the level of the chest. We look at the heart.
Yeah.
Right. So on the heart, you can have issues, with a heart attack. That's the common condition that people are aware of. Heart attack, you just collapse.
Heart failure.
Yeah, you look at heart failure, Yeah, we also talk about acute coronary syndrome. I mean, it's also part again of a heart attack, isn't it?
Yes.
We also go again at the level of our tummy.
Remember to simplify for our audience.
Right.
Just heart problems are heart problems, yeah?
Right.
And then?
We even go again at the level of the tummy. So this is just to help you remember, especially for the audience.
Yeah.
From the head to the chest, now to the tummy. So the level of the tummy, you look at the kidneys, right?
Yeah.
Inside your tummy, you can actually get, kidney disease, or basically kidney failure. Let's call it kidney failure.
Yeah.
That's from high blood pressure.
And I remember we say problems with the kidney can result from hypertension, or hypertension can result from kidney problems, isn't it?
Right.
Yeah.
So either you first develop a kidney disease, then you can actually get hypertension, or hypertension itself can actually cause kidney disease.
Correct. Yeah.
And then the other thing again that hypertension can actually cause, is problems with your blood vessels, especially in your legs.
Okay.
Yeah. So you suffer a lot of issues with your legs. You get to have a lot of sores that do not heal properly.
Yeah.
That can actually come about.
Itching, darkening of the skin.
Right.
In medical jargon, peripheral vascular disease, isn't it?
Exactly.
Yeah.
You can actually lose a limb or lose a leg. You can actually get to amputate, one of your legs
because of the problems with high blood pressure.
Definitely.
So, you won't please comply with your blood pressure medication. If you come across any issues, whether it be you are reacting to the medicine, please go back to your doctor and let them plan for an alternative medicine for you, not just stopping because it can lead to all these complications. And also, if you have a strong family history of high blood pressure, it's a good reason for you to keep on getting screened for high blood pressure by just getting your blood pressure to be measured from time to time.
That's true.
Yes.
That's true. I think one of the things, again, maybe that will bring us now to how we can cure, or is it something that's curable? I mean, is hypertension curable?
It depends, like you said, if it has got a specific cause, if it is your thyroid that is causing the high blood pressure, then that one becomes something that can be cured in a way. But in most cases, 90% of the cases, essential or primary hypertension is not curable. It's not treatable. We only manage to control it. Okay, so when we often come across patients who, after they finished their course, they've been given a 1 month course or 3 months course, they think that that's the end of it. No, it's not. Please go back to your doctor. It's a chronic condition. You need to go back to your doctor until when your doctor says you do not require medication, you also need to have medication. And this brings me to want to discuss what other things people can do to help with managing their blood pressure. What lifestyle changes can a person do, and what dietary and salt adjustments can somebody do. And it reminds me of an exciting development that happened at the University of Exeter in England, where they discovered that beetroot juice can also lower blood pressure. Dr. Tapfumaneyi, can you expound to our viewers about those issues?
Right. I mean, that is something that is very important, isn't it? So we often talk about lifestyle modifications, that starts with dietary modifications, how you can monitor your diet, and then we also look at like exercises by any chance. So when we look at lifestyle modifications, we're looking at a healthy diet. There's often something that is known as a DASH diet, like dietary advices for stopping hypertension, and that includes a low salt diet. So looking at very low salt in terms of your food. We're looking at a very low fat diet again, and we're also looking again at
So don't go and eat food without salt, of course. Because salt is important for what happens in the body. Definitely. What doctor is saying is when you are cooking, use a lower amount of salt. And I always say to my patients, after you finish preparing your food, you do not necessarily need to add more salt to your food. True. You can train your tongue to be used to lower levels of salt.
That's true. That's true.
You can continue, Doc. I just wanted to emphasize.
Sure. Thank you so much for that addition. And then something else that we also talk about is a low carbohydrate diet, because the idea is in trying to lower your weight. So the more you sort of lower your weight, the better chance you have, at controlling hypertension.
That's very good, Doc. We are introducing another concept. So the relationship between weight and high blood pressure, the higher weight you have according to your body mass index, the BMI, the more likely that you will have issues with hypertension.
That's true. That's true. So normally we advocate for a low carbohydrate diet. Now those are looking at the usual amounts of carbohydrate that you take, be it your rice, be it your spaghetti, be it your whatever carbohydrate that you take. Just lower down the quantities. That will actually help in reducing the weight, and the more you reduce your weight, the better chance you have at controlling your hypertension. The other thing again that can actually help you, we're looking at if you smoke, if you can actually consider smoking, stopping the smoking, that will actually go a very long way.
Smoking and vaping, they both damage your health, and in particular they raise your blood pressure. And then the other thing again is we even look at exercises. So there are, like recommended exercises that we sort of recommend even to the aged population, that if you can spend at least 30 minutes per day, of moderate, we call them moderate intense exercises, just 30 minutes at least on average per day, either you walk or you do brisk walking, that will actually go a very long way in trying to sort of control your blood pressure. Yeah, precisely. Important. And according to the National Institute of Clinical Excellence in England, precisely what Dr. Tapfumaneyi referred to is 30 minutes per day for 5 days in a week. You've got 2 days to rest. But 5 days, please commit yourself to low intensity exercises. And this, as he rightly said, includes walking, hiking, swimming, and those sort of like cardio exercises that you can do
cycling as well
in your gym, or in the outdoors.
That's true. So I think those are some of the things from diet, and then activity.
And like what we will explain in another video where we discuss about the exciting findings from the University of Exeter. Things like beetroot juice can lower your blood pressure, spinach can lower your blood pressure, kale can lower your blood pressure, celery can lower your blood pressure. And this is because all these foods are rich in nitrates, and these nitrates turned into nitrites, then into nitric oxide in our mouth by the action of the good Neisseria bacteria in our mouth. And that's subject to another video.
Yeah, so I think that's some of the things that we need to talk about. Again, on on the cure for hypertension. So I mean, it's always very important that people do understand that it's something that's not curable, like you mentioned initially.
Yes.
And then we can only monitor, we can only control. I think one of the things that someone with hypertension can do is just purchasing or just buying a blood pressure machine at home and then get to monitor yourself
or
at home.
some of these smart gadgets like your watch, like my watch, it can tell you your blood pressure, and and we are also going to discuss all these medical wearables, whether some of them are just wearables or medical devices, but like Doc correctly mentioned, you can buy the proper blood pressure monitoring cuffs, or you can use your smartwatch. And thank you, viewers. If you like this content, please subscribe, turn on the notification bell, and share this content with somebody who might benefit from it. And thank you, Dr. Tapfumaneyi. Do you have anything else you want to add for our viewers?
Well, I would want to say always make it a habit. Have your blood pressure checked at least once or twice a month. That will go a long way, sort of detecting it earlier
and
before it gets to complications.
And remember what we talked about the lifestyle modifications, dietary modifications. They don't treat or control your blood pressure by themselves, the exercise. These are some things that we put on top that might reduce your pill burden, the amount of medicines you are taking. And please, we don't have any evidence that if somebody prays for you, it will disappear. Please continue monitoring. We encourage people to get their pastors, their prophets to pray for them. Where myself and Dr. Tapfumaneyi and everyone who works here, we are God-fearing people, and we also work for God, if you like. So if you are in the faith sector or the traditional sector, continue monitoring your blood pressure, continue taking your medicine, while people pray for you or do traditional ceremonies for you.
That's true. Yeah, because it's very important that you need to understand that the fact that you're taking your medication does not make you less spiritual, does not make you go to hell by any chance.
Exactly.
Not at all.
And I've come across some people who, at one point, when they see that their blood pressure is now in the perfect range, they stop their medication. It is in the perfect range because of your medicine.
The medication,
that is proof that your medicine is working well for you, and that is evidence that you should continue taking your medication, not stopping it.
Right. I mean, that is actually very important. The other thing that, again, we probably did not communicate, or say...
you want to emphasize on?
Emphasize something is on, it's very sort of, it's very cheap to actually treat hypertension than actually to treat the complications that actually come thereabout.
Yes, and the complication can actually lead to your demise before your time, if you like. And of course the expense and also the suffering that comes with having the complication.
Exactly. Yeah. Because if you think of it, look at maybe let's say you're having kidney failure and then you require maybe dialysis every week.
That's quite expensive.
That's very expensive.
Or a stroke, you need one-to-one care with so many people. That becomes quite expensive. Or you become blind, or have to go and buy visual correction lenses. That's also quite an expensive. So all the complications lead to a financial burden, a social burden, and we don't want you please to get into these complications.
So you rather have it treated, and then it's very, very cheap. I mean, the blood pressure medications are actually way, way cheap compared to the complications thereabout.
Yeah, definitely.
Sure. I think that's all. Sure.
Okay, so please subscribe, turn on the notification bell, and share our content so that you can get even more, so that you motivate us to do even more content. Thank you very much.